Probably one of the biggest of the crowds if you just look around the room. And we're here to talk about our family medicine residency. I'd like to just extend a welcome to a number of guests that we have here. I'm not going to introduce the speakers, but just Jim Cownon is here. Jim's around. There, welcome. And Joe Burke from the Minor Foundation, who will get up and speak. Both of them will chat in a second. But Jan Dupree, who's served as our assemblywoman, but more importantly at our medical center, served as board chair twice, on the board 3 times over her many years in this community, is on a well-needed vacation and extends her, offered to come, and I actually told her I wouldn't let her. Not that I had any control over that whatsoever. But she extends her hearty congratulations and follows this project extremely closely. Jim Cownon has been serving as our mayor for several years, and I had the opportunity to sit with him a couple weeks ago in a more relaxed setting. He invited me to be a judge for the Mayor's Cup Festival of Lights boat parade, and that was a very entertaining evening on the docks, and it was lots of fun. Enjoyed seeing him. And, this is more of an announcement and a celebration. And he is going to come up. He's also our neighbor. Just lives down the street, and it's a wonderful thing to have, and we've had a great relationship over many years. So I'd ask Jim to come up and just start us off a little bit.
Thank you, Stephen. It's a great pleasure to be here as part of the team that's sharing and welcoming you here and really sharing in the announcement today. It's nice because it lets me be part of the team that really celebrates the actual formation of the residency, which I think is absolutely critical to healthcare in the North Country. It is a tremendous step up, as you know. Primary care. People are really the ones that we want people to visit all the time in the healthcare field. We don't want them to have to go further up the chain. These are the folks that help keep us healthy, and this is a part of the healthcare system in the North Country that really has been needing augmentation. It really is an area where we have a shortage of folks, and presenting a residency here in the North Country will certainly attract people here. It's a multi-year residency. People are going to get used to this community. They're going to fall in love with it like all of us have, and we're going to retain almost all of them, and that's an order. And I think that it's really going to make a huge difference in our health care. And I want to share my congratulations in getting it done. Those congratulations really should go to lots of people who were involved. I started by saying I was part of a team and welcoming you. You should see the team that's really responsible for getting the residency done. Tremendous group of organizations, a tremendous number of people. Stephen's mentioned the board members, Janet in particular, but other board members really took a great risk in going down this path. And I think that the fact that we've made it, the fact that we're here to actually celebrate the start of the residency, is a great credit to their courage, and they really ought to be very much congratulated. So I'd like to just thank you for that. And of course, I am a politician, and I am very parochial, and I'm very glad that there will be 35 new jobs in downtown Plattsburgh. So that's another thing that's very important. So congratulations to everybody involved, and I look forward to just continuing the great relationship and the great outcomes. So thank you.
Thanks so much for coming, Jim. And I'll work on that order. So a family medicine residency is a training program for physicians when they finish medical school that want to go into the art of primary care. The training programs are 3 years, and they rotate through many different specialties. We anticipate this program will start out as what's called a 4-4-4. 4 residents each year for 3 years. Our medical community here is large enough to go to support 6 each year. And we don't know whether or not we as an organization have the financial resources to support it, but our goal would be to stretch to that. The North Country is projected by 2020 to have a shortage of 100 primary care physicians. And you say, how do you address that? Well, this is one way. Mayor mentioned keeping them in the North Country. Statistically, family medicine residents, and it's very different for family medicine than other specialties. Family medicine, 60% of residents will locate within 100 miles of where they train. And we think, and if you look at it's almost the whole second, third, and fourth row here are the staff of our family medicine center. And they just raise your hand. We work in the family medicine center. So, okay, I got it second and most of the fourth row. It's just a great staff. And I think that once they meet these people and they meet the rest of you in our community, they're going to want to stay here. And they're going to want to stay in this community, and that's our goal. We want to share with you some really exciting updates that are going on. Alice Recore is our board chair, and I'd ask Alice just to come up and make a few comments.
Thank you, Stevens. Good afternoon, everyone. Work on the family medicine residency program began in 2013 with what was then Fletcher Allen and is now the University of Vermont Medical Center to establish CVPH as a teaching hospital. The CVPH board was thrilled to support it. We've come so far in such a short time. Perhaps some of the biggest news is that we've received program accreditation from the Accreditation Council for Graduate Medical Education. This is terrific news. We have also received initial commitment from other area hospitals to have residents rotate through their hospitals as well to recruit residents to join their facilities. Again, some really positive news and shows the growth of CVPH and their commitment to the community to provide the best in healthcare. It's this type of support from other healthcare organizations that will help us alleviate the provider shortage and ensure our communities have adequate access to primary care for years to come. So my thanks to Stevens, his executive staff, and the management team, and the University of Vermont Medical Center. This is great news, and we are so pleased to share with you today. Thank you.
Thanks so much, Alice. When we first started even thinking about this, prior to 2 years ago, it was just kind of a dream. Dr. Brumstead, who can't be here today, is president of our health network. And I had lunch with Dr. Tom Peterson and several of the family medicine residents that currently train in Milton. And we talked about the feasibility of a program developing here. And once we made the decision, the speed at which Dr. Peterson, and most of all John King, is John here, I saw him. Thank you. John pretty much on about a 30 to 60 day notice dropped almost everything he was doing and commuted over here, and he's a motorcycle guy, so I think it was just to ride the motorcycle. I'm sure he took the long way up to the islands and then back through New York, but he came over here and dedicated his life for a year and a half to help us get to this point, so we're very grateful for that. But Tom and his whole department have just been tremendously supportive, so Tom, if you come up, Dr. Peterson.
I think John could actually beat you on his bicycle.
I agree. At least I'm on.
So Mayor, we'll try to follow orders. This is actually a bit of a deja vu for me because I actually trained here as a resident for 3 or 4 months in 1985, and I was talking with Dr. King on the ferry over there. I remember those rides over, and I think there was like a little car that we picked up next to the ferry dock. It always had 1 gallon of gas in it. One tire with a little less there. And we would deposit ourselves here, and we actually had really an excellent training experience. And so I've always remembered this hospital with good memories. So I am a practicing academic faculty physician in the network. Actually, I practice in Colchester, Vermont, and I'm the chair of the Department of Family Medicine at the university. And so I suppose as the academic leader, I'd just like to welcome our new affiliated program, our new partner in Plattsburgh. And I really congratulate the UVM Health Network for its vision and for taking the responsibility to getting this program started. I have like 3 or 4 points I'd like to hit. First of all is about academics or medical academics. And so I'll say the new family medicine residency program is actually a perfect complement to the one that we have in Milton and Burlington. That program is obviously based at an academic medical center and has had a lot of traction over the last 35 years. It's one of the oldest programs in the country. And having a community-based program across the lake that we can share resources and teaching opportunities with, I think is just a great opportunity both for the North Country, but also for the residents and the faculty that are training in both of those programs. You know, at the college there and at the medical center, there's a long and passionate history about medical education. And I can say that over the last 2 years, I really found that that same passion exists here at CVPH, the same passion for teaching, and the same passion for patient care. And so I really have, based on that alone, I have every confidence that we will achieve our goal. The second thing is about the value to the region. You know, it doesn't actually matter what type of residency program you add to a hospital that wasn't a teaching hospital, but to get a hospital to become a teaching hospital, the value of that area really can't be overstated. The network is committed to medical education, to family medicine education, and I'm sure it's going to thrive, but for CVPH, which is a vigorous regional hospital, for it to become a teaching hospital is an important complement to the programs at the medical center in Vermont and our other partners. But also the family medicine residency will elevate the academic stature and the appeal of Champlain Valley Physicians Hospital. And it certainly will boost the likelihood of attracting important workforce members, including residents, medical students, and other allied health professionals. So we're looking forward to that. To Mr. Mundy's point, 2 of our residency faculty here on the faculty actually are graduates of the University of Vermont residency or medical school program, and so they didn't stray very far, including our new residency director, Tony Lopez, who you meet in a minute. The third thing is the value to the patients, which is, after all, is really what this is all about, the families, individuals that live in our communities in the North Country. And the family medicine residency, if you look at it, does elevate the standard of care. Our patients will benefit from the highest quality care available and the latest treatments, and that's always the goal. In terms of quality primary care, if you build the workforce for the North Country, it's going to help the entire region, whether it's in Vermont, northern New York, or the Adirondacks. We know specifically that northern New York is underserved, and it's a great help to have an academic program to attract academic family physicians who actually will practice themselves and see patients, but also to train and retain those new physicians who will care for us and our families. So it's all about building the workforce and keeping it at home. And in the big picture across the country, we know that if you add primary care to a rural or underserved area, whether it's in the west, the southeast, or the northeast, it improves access to primary care, improves quality, and lowers the cost of the region. So that's really a double win. So, and finally, I would just say that we're really thrilled to work with our colleagues, our partners in Plattsburgh, to help establish this program. It's going to have a huge impact on the North Country, and we're looking forward to that for some time to come. So it's been a pleasure to work. The job actually has only started. I think that's important to remember. And I would like to especially thank John King. Can you stand up and just sort of wave your hand there? So John is the Vice Chair of Family Medicine. John did a great job and was very willing to come over here. And the only cost to me is I had to do his work for 2 years. So,
good. Thanks so much. Dr. Peterson mentioned two graduates. Mentioned two graduates of the program. Steve Hines is here. Behind the balloon. Steve trained at University of Vermont and came over here and has been leading our family medicine center as a clinician, and just been a tremendous resource for us there with our staff here. And he's been joined by Dr. Tony Lopez. And Tony will be the first director of the family medicine residency at CVPH. He did his undergraduate and medical school at UVM, then got a master's in public health from Mount Sinai School of Medicine, did his family medicine residency at Jamaica Hospital in Queens, trained and practiced in New York City in a couple different settings over 10 years. Loves the outdoors, has family in the North Country, and really wanted to get back to this region, and the opportunity was right and the time was right. And so that to me is a double win for us. So I'd like to introduce Dr. Tony Lopez.
Thank you for the introduction. Yes, so I'm excited to be here. So like to say is that since I've been here for about 4 weeks, and I must say there's been a lot of support at all different levels, not only at the Family Medicine Center, from the hospital administration, but also on the network level. It's quite apparent that this program is very important for the region. As Stevens was saying, yes, for me, well, at least I tell my family and friends down in New York, the reason why I left is that a lot of this job checked so many boxes. It was a good career move. It was a great opportunity to start primary care in this area because of the need. So some of the things that we're going to be doing in this next year, it's all about recruitment, because we plan for 2016 to have 4 residents. One of the things we're going to do in the next couple of weeks is we're going to travel to a national conference where we're going to have an opportunity to speak to prospective medical students who would like to come to our area. The other thing that we're doing is that we're working with the Family Medicine Center and the medical director, Steve Hines, with transforming and kind of expanding the practice to include a lot of different aspects of primary care, which will be important for residents when they train.
So we're really appreciative. The goal in Kansas City, and then also in Boston as well, right? Is a regional, is to, and I heard a presentation just last week for our foundation here. 6,000 applicants to the University of Vermont Medical School. And from that, they interview 600 plus or minus prospective students. And it gets down to an entering class of about 140. So it's really well respected across the country, very selective. And it's also attractive. It has a wonderful reputation, much higher ratio of med students going into primary care than the average medical school across the country. So they're well known for primary care. And Dr. Lopez and his assistants will have that extra oomph of the reputational alliance as we go out and try and sell this program. So thank you very much, and thanks to everyone for their efforts. Dr. Joe Burke is no stranger to this community, this region, this organization. Served here in our community as president of Plattsburgh State, served regionally in the chancellor's office of the entire SUNY system, but most importantly to this organization, his relationship in the relationship of the Minor Foundation and the Minor Institute. He's been a tremendous friend to this organization for years, and I've known him for 13 years, and just a great friend. We've worked very closely on a number of projects. The Minor Foundation supported our surgery edition. They've supported this organization in so many different ways over the years. And Today, Joe is here to talk about their support of the Family Medicine Residency. So Joe, come on in.
Thank you, Stevens. By the way, could Paul Swoboda, there's two trustees of the, Paul, where are you? I wanted to recognize, we're the two trustees of the Minor Institute, of the Minor Foundation. In November of 1924, William Minor wrote in the Shazy School magazine, Our Inheritance. He said, we have inherited this beautiful Champlain Valley, its lovely lake, its vista of mountains, its panorama of woods and fields and limpid streams, its restfulness, its neighborly feeling, its good citizenship, and its blessed remoteness from cities. William Minor worked to make the Champlain Valley not just a great place to visit, but a grand place to live. In 1924, he created the William H. Minor Foundation to fulfill that promise. It would fund the Shazy Central School, an Institute for Research, an Education Institute on Agriculture, and build a hospital that would compete with the best in the country. The Plattsburgh Sentinel, the newspaper at that time in the mid-20s, raved about the emerging physicians' hospital that was built. It declared even the most sanguine of Aladdin's dreams could not compare to what we saw rising before our eyes. Physicians' Hospital held 4 spacious operating rooms, each with an amphitheater and an observation place for each of those. Perhaps he foresaw the importance later of having a residency program. In the end, however, it's not just, and by the way, the Mayo brothers said in the late 1929, when they were here for a conference, that it was one of the best equipped hospitals in the country. Yet in the end, we all know the success of the hospital is the physicians who practice in the region. William Minor would have loved this residence program because he believed that people learned not by sitting and listening, but by learning and doing. And so Paul Swoboda and I, the two trustees of the Minor Foundation, are most pleased to award a $1 million grant to help with this program. William Minor would be smiling today. Thank you very much.
It's hard to follow that. Probably the only way to follow that is to say thank you so much for coming. And I would extend an invitation to you for about 11 months from now, where we'll hold a ribbon cutting to welcome our new residents. So please enjoy the food that we have and drinks here. Thank you so much for coming. And most of all, thank you for your support. Joe, Tom, John King, welcome. To Dr. Lopez and to the staff of the center, thank you very much. We appreciate it and look forward to working with you.